Becoming a more confident and skillful communicator in English is similar to the journey a patient takes when they recover from a health problem. Let me explain. First, the health problem needs to cause the patient so much suffering that they decide they can no longer live with it and seek professional help. Likewise, if you're watching this video, you've probably had some unpleasant or embarrassing experiences when communicating in English that have caused you enough suffering to motivate you to seek help. Now, once the patient gets help, they must follow an effective treatment that their doctor or healthcare provider prescribes them. A truly effective treatment plan will directly address the root cause of their health problem and get the patient healthy as quickly as possible. Let's say the sick patient is suffering from a vitamin C deficiency. Which is going to be a more effective treatment plan? Taking a multivitamin or taking a concentrated vitamin C supplement? Of course, the concentrated vitamin C will be the most effective. This is because it directly addresses the patient's problem. Not only is the multivitamin far less effective, but it's actually also dangerous because it can make the patient even sicker, since high levels of fat-soluble vitamins could cause toxicity. Unfortunately, if you're like most of the medical affairs professionals I meet for the first time, you've been taking the multivitamin approach when it comes to improving your English by studying general English and hoping that it will make you confident. In fact, you already probably know a sufficient amount of English. You may have scored high on an English language test like the IELTS or TOEIC. And you may have even been able to get around in an English-speaking country. Yet you still aren't confident using English at work, and you can't express yourself the way you'd like to. Your level of English does not match your level of professional expertise, and it's stopping you from improving your job performance, and it's also holding you back from securing future opportunities. What's even worse is that, like taking the multivitamin, following this general approach to acquiring the communication skills you need to be successful often results in a toxicity that comes in the form of an overload of irrelevant information that only confuses you more and slows down your progress. Just as the patient would take concentrated vitamin C to solve their deficiency, you must follow a custom plan designed specifically to equip medical affairs professionals with the specific communication skills they need to feel confident as quickly as possible. You know that if you could feel more confident and comfortable communicating in English, then you'd be able to level up your job performance and unlock amazing opportunities that would ultimately allow you to make a bigger impact, increase your income significantly, and enjoy more freedom to create an amazing future that you and your loved ones deserve. So now the question is, how can you get past this wall and alleviate your pains, fears, and discomfort surrounding your ability to communicate in English? You need to first undergo a clinical assessment of your current English communication skills to clearly identify your problems and weak points. Then, you must follow a focused action plan that's specifically designed to give you the training you need to fix these problems quickly so you can feel comfortable communicating with your colleagues in English and confidently thrive in your career in medical affairs.